Why do Kayser-Fleischer rings form with Wilson's disease? Imagine a tiny ring forming around the edge of that can tell doctors a lot about what's happening inside your body. That's what happens with Kayser-Fleischer rings in Wilson's disease. These rings are caused by abnormal copper buildup in the eye, specifically in a part called the Descemet membrane of the cornea. Copper is a metal that our bodies need in small amounts, but in Wilson's disease, the body can't get rid of it properly. This leads to excess copper circulating in the blood and depositing in various organs, especially the liver, brain, and eyes. Wilson's disease is a genetic disorder caused by mutations in the ATP7B gene. This gene normally helps the body excrete copper through the bile, a digestive fluid. When the gene doesn't work right, copper starts to accumulate in the liver first. This buildup damages liver cells, causing conditions like hepatitis, fibrosis, and even cirrhosis, which is scarring of the liver. If the liver becomes overwhelmed and can't store more copper, the excess spills into the bloodstream and travels to other parts of the body. In the eye, copper from the bloodstream enters the aqueous humor, the fluid in the front part of the eye. From there, copper moves through the eye's endothelial cells into the Descemet membrane. Copper binds with sulfur compounds in the tissue, forming tiny granular deposits. These deposits create the characteristic brownish or greenish ring around the cornea. Usually, the copper deposits start at the top and bottom of the cornea before forming a complete ring. Interestingly, these rings do not affect vision but are a sign of systemic copper overload. The presence of Kayser-Fleischer rings is a helpful clue for doctors diagnosing Wilson's disease. They are often seen in patients with neurological symptoms and sometimes in those with liver problems. Detecting these rings involves a special examination called a slit lamp exam, which allows an eye specialist to see the deposits clearly. The rings are not harmful by themselves but reflected the underlying issue of copper excess in the body. From a liver health perspective, these rings are more than just an eye feature. They indicate that copper is building up systemically because the liver isn't functioning properly. The excess copper causes oxidative stress, which damages liver cells and can lead to serious liver conditions like cirrhosis. Over time, this damage increases the risk of developing liver cancer, known as hepatocellular carcinoma. So, the rings serve as an external sign of what's happening inside the liver and the rest of the body. In summary, Kayser-Fleischer rings form because of defective copper excretion in Wilson's disease. Copper builds up in the liver and then spills into the bloodstream, eventually depositing in the cornea's Descemet membrane. This results in the characteristic ring around the eye, which signals systemic copper overload and potential liver damage. Recognizing these rings helps doctors diagnose Wilson's disease early, allowing for appropriate management to prevent further liver damage and other complications. Always consult healthcare professionals for personalized diagnosis and treatment options.